I think the World Health Organization have recognised quite early on there was an increasing outbreak in Africa. The public health authorities are working closely together. I think we're in a different position globally now in terms of detection and surveillance of outbreaks. Like many countries, ourselves included, we've increased our laboratory testing procedures. There's greater collaboration through international health regulations. So I do think there was a lot of learning that took place during and after the COVID pandemic.
Do we know when the last case of monkeypox was diagnosed in Gibraltar?
It was in 2022. We had a small number of cases. I think it was about 5 or 6 who were actually diagnosed here. That's not to say transmission happened here, but it was back in 2022.
And how is it? How was that managed?
So only a couple of those patients ended up hospitalised, and we have isolation facilities if somebody does require medical treatment. For those who were well enough to stay at home, what we did was we put in place daily phone calls to them to check they were all right, and we had isolation. It was quite a prolonged period of isolation some individuals had to be subjected to until their lesions had scabbed over. So some people we can manage as long as they can self-isolate at home, and some people we had to admit into hospital.
How could one catch monkeypox? Is it airborne? What should people do to lessen their chances of getting it?
It's a slightly different virus, this one, so it's close skin-to-skin contact. You could also catch it if somebody's infected and coughs directly onto you. So although it's not truly airborne, you can get that viral transmission if you're very close contact with somebody. I mean, you're absolutely right. There's a lot of learning that we took from the pandemic, and it sounds very basic, but it's about hand washing.
Would that be your sort of your number one top of the list?
Absolutely. It's hand washing. It's being mindful for our healthcare workers. If we have a suspected case, it's making sure they've got the right masks and they're fit tested for those. It's about, if there are suspected cases, washing bed linen at correct temperatures, because you can get the virus surviving for a certain amount of time in bed linen and on surfaces. So it's basic infection control measures. And I'd say to the public, don't get too concerned, because over the next few weeks, we're going to be having a real drive on improving infection control practices throughout the GHA hospital. This is a good opportunity for us to revisit all those basic infection control practices.
What about vaccinations and the potential need for them?
So there isn't a dedicated Mpox vaccine, but the smallpox vaccine does give you some form of protection. And back in 2022, we did a very targeted smallpox vaccination programme. Now, some of our older generation as well may have received a smallpox vaccine when they were children. If you've been to a affected area, and you can look on the World Health Organization, they'll give a list of countries which are the affected areas, because that will be updated and changed. Our advice is phone 111 for advice. Don't, if you develop a flu-like illness or blistering lesions, please don't just turn up at A&E. Call 111, we'll sort out the pathway to arrange for you to be tested. And then it is really just about maintaining vigilance. And with our doctors as well, they will be asking people about travel histories and holiday plans. We have very good healthcare facilities here. We've got, good diagnostics. We've got good, critical care treatments. We've got links into the UK so we can get expert advice from there. So we are in quite a different position to where we were pre-pandemic.